I asked her why she was still taking Sertraline. She looked at me like I had asked her why she was still breathing. Doc, I have heard that if I start an antidepressant, I have to take it for life and I can never come off the medication. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. My patient has been on an antidepressant for 7 years. Nobody ever told her she could stop. She came in for a routine visit. I asked her why she was still taking Sertraline. She looked at me like I had asked her why she was still breathing. And she said, "Doc, because I thought I had to take it forever." But the fact of the matter is she didn't. And the reason why this is important is because the fear of long-term use of antidepressants is a significant barrier to patients actually initiated antidepressants. Now, she didn't need it for life. And if you are on an antidepressant right now, this episode might be the most important one you ever watched. I have many patients who at the time of recommending an antidepressant, the first thing they tell me is, "Doc, I have heard that if I start an antidepressant, I have to take it for life and I can never come off the medication." And this stops them from taking it. And that is the reason why this episode is really important. So my patient's name is Monica. She's 46 years old, school counselor. She's married, has 2 kids. 7 years ago, she went through a terrible divorce from her first husband. She wasn't sleeping. She wasn't eating. She couldn't get out of bed. Her doctor put her on Sertraline, which you also know as Zoloft, 100 milligrams, and it worked. Within 6 to 8 weeks, she started feeling like her old self again. But here is what happened next. Nothing. And I say nothing as in nothing. Nobody ever brought it up again. Nobody said, "Monica, let's check in on this medication. Let's talk about whether you still need it." Every year at her annual visit, the prescription just got renewed automatically. She never got another PHQ-9, never got another GAT-7. She just went through the motions with the medication, just like a magazine subscription nobody ever canceled, or like a gym subscription that we never use but we're afraid to cancel. By the time she came to see me, she had been on Sertraline for 7 years. She had remarried. She was happy. She was stable. She hadn't had a depressive episode in over 6 years. So I asked her, "Monica, has anyone ever talked to you about coming off this medication?" And she said, "No, I just assumed I needed it for life, just like my blood pressure medicine." And that's the myth I want to destroy today. Antidepressants are not blood pressure medicines. They are not insulin. For many patients, they are not forever. They are treatment for an episode. And when the episode is over and you've been stable long enough, there is real evidence-based conversation to be had about stopping it. And this again is important because if you're watching and you were advised to take an antidepressant and you said, "Oh no, I don't want to take it because I can never come off of it," I want you to keep watching or listening. Because nobody is having this conversation about stopping antidepressants, and that is the problem. That leads us into the science section of this podcast episode. Let's walk through the science, and let me walk you through what the evidence actually says. How long should you be on an antidepressant? Well, depression treatment happens in 3 phases. The acute phase, right, when it just happens and things are bad. The acute phase lasts 6 to 12 weeks, and it's about getting you into remission, getting the symptoms under control so you can become a fully functional person again. Now, secondly, the continuation phase, 4 to 9 months after. It's about making sure the depression doesn't come right back. And then there is the maintenance phase, which is about preventing a brand new episode down the road. Guidelines say that after that first episode of depression, continuation and maintenance treatment should last at least 6 to 9 months. Did you hear that? At least 6 to 9 months, ideally a year after full recovery. After that, the medicine should be gradually withdrawn. That is what the science says. For patients who've had 2 episodes, some guidelines recommend 2 years. For patients with 3 or more episodes, indefinite treatment is often recommended, meaning you take it for the rest of your life, because each episode increases the risk of the next one. But here is the critical point. Those recommendations for indefinite treatment are based on expert consensus. They were not established by long-term randomized trials. Randomized trials are basically the highest level of evidence in medical research. The median clinical trial for an antidepressant generally lasts 8 weeks. The median real-world use in the United States is 5 years. That is an enormous gap between what was studied and what is being prescribed. So who is staying on it too long? Surveys of long-term antidepressant users found that 30 to 50% had no evidence-based indication to continue treatment. They had taken the medicine, gotten better, stressors had been resolved, but yet they were still taking the medicine. In the United States alone, half of all antidepressant users have been taking them for more than 5 years. In the United Kingdom, nearly half have been on them for more than 2 years. The increase in antidepressant use over the past 30 years is not because more people are starting them, it's because people are staying on them longer. And the longer patients are in the maintenance phase, the less often their treatment is reviewed by their doctor. This has a name that researchers call legacy prescribing, meaning somebody started the medicine, no one stopped it. And means when a medication that was initially appropriate is never discontinued after the treatment period ends, in scientific terms. That is legacy prescribing. Monica was a textbook case of legacy prescribing. 1 episode, full recovery, 6 years of stability, and nobody ever said, let's talk about stopping this medication. Now, this brings me to another part of the story where we build the patient-physician allyship, and this is where your primary care doctor or any other doctor, for that matter, has to step in and right the wrong. Because you're going to ask me, well, Dr. Takem, I heard this long diatribe about antidepressants and stopping them, but what has that got to do with me? Well, I'm glad you asked, because it's important to talk about what happens when you stop antidepressant. Because many times people don't want to start an antidepressant because they are afraid that they will never get off of it. And some people don't want to stop the antidepressant because they are afraid that they will relapse into something that happened 5, 6, 7 years prior. But this is where it gets complicated. And this is exactly why doctors don't bring it up. Because stopping an antidepressant is not like stopping, ibuprofen or Tylenol. About 1 in 3 patients who discontinue an antidepressant will experience discontinuation symptoms. The most common symptoms are dizziness, nausea, insomnia, flu-like feelings like when you have the flu, sensory disturbances, electrical shock sensations, and some people even have mood changes. Now, there is something we use called a mnemonic, which we use to remember all the symptoms. The mnemonic is FINISH, right? It starts with flu-like symptoms, insomnia, nausea, imbalance, sensory disturbances, hyperarousal. So if you don't remember anything else, remember this mnemonic, FINISH, because these symptoms typically start within 2 to 4 days of stopping an antidepressant, but more importantly, resolve within 2 to 6 weeks. It's not a permanent problem. But let me tell you what is a real problem, and this is critical that you know. Discontinuation symptoms can look exactly like depression coming back. I know it's confusing, but that's the fact. Low mood, insomnia, anxiety, irritability. If your doctor doesn't know the difference, they will tell you, see, you still need the medication, and they'll put you right back on it. But as I've said before, we are patient allies, patient and physician working hand in hand. And this is what your doctor needs to know or will tell you so you know the difference. Discontinuation symptoms start within days. A true relapse of depression takes weeks to develop. All right, so as we wrap up this episode, here is your action plan. And I would like you to really pay attention to this. Number 1, if you are on an antidepressant and you've been stable for a year, ask your doctor, do I still need this? If they've never brought it up, you bring it up. Number 2, never stop cold turkey, ever. Stopping abruptly causes withdrawal symptoms that can feel like your depression is coming back, and it's not. You need a slow taper, supervised by your doctor. Number 3, if you want to come off your medication, ask about adding therapy, specifically cognitive behavioral therapy or mindfulness-based cognitive therapy. We'll have another conversation about what CBT or cognitive behavioral therapy actually is, so stay tuned. Now, the evidence shows that slow tapering plus psychological support is as effective at preventing relapse as staying on the medication. Number 4, know the difference between withdrawal and relapse, because people get that confused all the time. Withdrawal starts within days. It includes physical symptoms like dizziness, electrical zaps, and it usually resolves quickly if you restart the medication. Relapse takes weeks to develop and looks like your original depression. If you're not sure, call your doctor. If he doesn't answer, call me, okay? And number 5, if you've had 3 or more episodes of depression, you may genuinely need long-term treatment. And that's okay. This episode is not about shaming anyone for taking medication. It's not about creating fear and anxiety around antidepressants. It is meant to relieve the antidepressant stigma and fear that exists in communities. It's about making sure the decision to stay on the medication or come off the medication is yours, informed, and made with your doctor. Antidepressants saved Monica's life, but 7 years later, the prescription wasn't saving her anymore. It was just there because nobody asked the question. Don't wait for your doctor to ask. Ask them. That's why you paid that copay to see them. They are the experts. You come with your questions and make sure you leave with answers, okay? All right, so if you like this episode, share it with somebody, but especially stay tuned for next episode because the fight for your health care doesn't stop here. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.